Are we live? Let's see. Oh, I think we're up. Hey guys, gals, everybody there?
Can you hear?
Yeah, it's on. I think we're good. Guess we can try to say something.
Yeah, see. Can everybody hear me? Hear you?
Hello.
I want to hear some joint scrub. It's not correct.
Do some seated adjustments here before we get started.
Crack my neck. Oh. I have to do it badly. Oh, it's not. It's not bad. Adjust my face.
We could always do the nose adjustment.
All right, let's see. Oh, yeah, do that one.
You grab those like this and you just hold it.
Hello. Oh, hi from the Philippines. Angel, hi. Say hi to them.
Hey everybody. Angel, perfectly fine. Hey guys, ladies, everybody, sorry. First time streaming here, so thanks for coming, everybody. Just going to give it a minute to make sure, everybody, that we're 86 so far. Wow. Okay. Hello from England. Oh, I appreciate it. Oh, I appreciate that, Adam. That's right. It's right there. Oh, thank you. Soul Light, Sarasota, welcome. Florida. Okay.
Give everybody a second. See. Hi. Oh, lots of people from Ohio. Hi.
Hi. Orlando,
Michigan.
Okay. Yeah,
Jessica.
Australia. Oh my goodness.
Kentucky.
Yeah, everybody tell me where you guys are from and where you guys are watching from. Does the sound okay? Am I no trolls? I can't hear you.
Is it loud enough?
Chicago, San Diego, San Antonio, Scotland.
This is fun.
Oh,
cool. Well, you want to just start with your story?
Sure. I appreciate everybody for coming. I really appreciate all the support, and we've been doing this about 2 years, and just very thankful for just everything. And I know most of you probably know my sister. She's one who got me off my butt and doing some YouTube, and of course the whole pandemic and all that pretty much got me out of my hole.
It's a lot of people were asking what made you finally start YouTube. So I guess you could say. Would be like Brenda tried to get you to do it years ago. You wouldn't do it. He said he'd put a paper bag on his head and do it years ago because he didn't want to.
Yeah, I felt pretty comfortable in my practice. I've been practicing since 2007, so I really never felt the need to do a YouTube until the pandemic, and then most of my patients stopped showing up, and so it was.
You had time.
I had a lot more time
to do it. So you drove to Brenda's and did a video with her?
Yeah.
No paper bag needed.
Appreciate that. Vagabond.
That's funny.
Oh, good night. Is it Raphael Carey? Thank you.
Oh, good night. So yeah, you did the video with Brenda and then...
Got me going, got me off my hole. Mm-hmm. But yeah, I think most know that my Brenda and I and my brother Max, who just graduated, we're all chiro kids. And so we grew up all being adjusted. We were homeschooled. The chiropractic was a part of our lives. And, I learned how to adjust when I was a teenager. And so did my sister Brenda. And where do we start?
Nice. HRH, you're the goat. No, that's sweet. That's nice. Cool. So yeah, just tell them why you became. Some people were asking on Instagram. We took questions on Instagram, but if you guys have questions here, go ahead and put them up. So a couple of people here, Maria was asking, Let's see. I'd love to hear your backstory, your journey into chiropractic. And I also want to know why so many other offices don't give the same treatment. Is it because of insurance or not enough time? I want to know. So maybe give why you
It's a good question.
became a chiropractor and
Yeah,
why you do things the way you do.
I was in college and I took physiology, and it probably was the most fascinating course I had taken in my undergrad. And somewhere in there, I knew I was going to be a chiropractor. I just loved all the intricacies and complications, things about the body that were so complicated that it just intrigued me so much that, I already knew how to adjust, but I wanted to be a chiropractor, or at least take care of people, help people at that point. So I started college like 14, finished my undergrad at 19, and then I started chiropractic college. And I was like the youngest person in class. And I actually, if Craig or Eric's out there, I'm sorry, guys. I told everybody I was 21, I think, because, you're spending your lives with these people for 3.5 years. And, I didn't want to have to be the youngest one in the group. It was, it'd be, oh, there's Ed.
So he
Doogie,
thought, yeah.
Doogie Howser or whatever, So, started there at 19 and graduated at 22. Started working with my father in 2007. And actually, let me back up. So I met my wife, Carlin, or at the time at her church in Ormond Beach. So the school's in Port Orange on the East Coast. And that's where I met my wife, was at her church. We started dating she wouldn't date me for a few months, but finally she finally gave in.
Played hard.
So, but then we got married about 9 months before I graduated, and then moved over to Sarasota from Port Orange. Started with my father, and been practicing ever since.
Let's see what someone's saying. I only watch Chicky KT. I only watch you and Brenda. Aw, cool.
Thank you. I appreciate it. Thank you for the support.
Why do you? Let's see. I don't know how to say.
So that question, I think, was it Maria that asked that?
Maria, yeah. And then she wanted to know why so many other offices don't give the same treatment.
I kind of would know. My dad started, I was a little kid in my dad's office, and he had a whole waiting room filled with people. My dad would see 80, 100 people a day when I was a kid. He would do what they would consider Gonstead now, which...
Yes, Jamie, it was the best decision of my life to date him and marry him.
This guy, JB Peer, was my best man at my wedding, so you guys give him a heck hand.
Hi, Jamie. I don't know how to say her name.
So I think the kind of orthodox chiropractic, they teach volume. They want you to see a lot of people. And I think it just was frustrating for my father, where you can help people, but you don't really see a lot of permanent change. So when my sister and I were learning to be chiropractors, he had changed his practice to where the care was longer and not real short sessions. And chiropractic biophysics came out in 97 or so, mid 90s, where you have to do a lot of stretching to change posture. It's not just adjustments and, that fixes people. And so you have to, change people's lives through stretching. And that's where the permanency comes through. And so it's simply just not able to be done very quickly. You have to spend time with patients, and it's a lot of work. It takes more time, but I think it's just not as popular because, first of all, the kind of the orthodox chiropractic taught you need to see a lot of people. You have to have volume. You're not a good chiropractor if you're not seeing 100 people a day. A busy day for me, I might see 30, 40 people. But that's with my father there sometimes. And so I'm usually trying to aim on a regular return visit somewhere between 15 minutes or so, 15, 20 minutes. What you guys are seeing is the initial visit, which I do spend at least 45 minutes to an hour in the office on new patients. It's simply,
you're giving people more time if you haven't.
Yeah, it's just, you can't properly do an initial visit. I don't know how you do one in 10 minutes. It's just, I can't even say hi to people in 10 minutes. So, yeah.
There's some questions there. Let me look through here.
Sometimes when you email somebody, you get
That was Tiffany Jenkins, by the way.
I would like go through there and see what's in there.
Let's see here. What health conditions, major health conditions that would disqualify you from chiropractic care? I mean, they call it your scope of practice, right? So in school, I think there's 5 major things. I'll see if I can remember them all, but broken bones, lacerations, cuts, dislocations, childbirth, these are things that are out of our scope. Many things are in the scope of a chiropractor. So, I think most people that are here probably have heard me talk about the spinal column being the conduit with which your brain communicates to your body. So if there's inflammation to your spinal column, your nerves aren't communicating properly from your brain to your body. So therefore you have dysfunction and disease. So if you have any more hypertension, stomach, I have a lady the other day with gastric paresis and she's immensely better. People with hypertension come in, you can, if you get to the cause for why there's hypertension. Now, for instance, somebody can be dehydrated, right? Dehydration causes your blood volume to go down because your blood's thicker. Now your heart has to work harder. So obviously a chiropractic adjustment is not going to fix somebody that's dehydrated. So I'm not saying that every single person with hypertension can be helped with chiropractic, but if the cause of the hypertension is inflammation to the cardiopulmonary nerve from forward head posture, I think go click it. Wow. I really appreciate that. Miguel, thank you so much. Thank you for the support. If you're ever in Sarasota or Florida,
call and try to get on the list.
Yeah, we really appreciate that.
Thank you.
Thank you. Let me see here. So I hope that answered that question. Is there any disquality from chiropractic care? There are certain things that would be modified. I've had people with rods in their spine, where you have to, see, the surgeries never deal with the reason for why the rod was put in there. There's a cause and an effect. And most treatment in America seems to be just dealing with the effect instead of going for the cause. So I treat many people with back surgeries, many people with, I had a guy with compression fractures, but you usually work around those areas. You don't necessarily need to work directly on the area of symptoms. I think many doctors want to, work on where the pain is and trying to influence the bone spurs or the disc injuries.
So this one, do you get sore? So it's Charlotte. Do you get sore elbows from the UK? Hi.
My first few years, it's more or less the skin from just the movement, the underlying fascia gets sort of tugged on a lot, and that has to get stronger. So you will have some, when you're doing a lot of elbow work, but it's so tough now. They're both pretty. I think my body stopped talking to me a long time ago. I get adjusted 4 or 5 times a week, so I'm really privileged. My father works with me, and that really just prevents me from having to. It helps. You have to be able to have the energy in your own body and being poured into yourself so that you actually can care for other people. I tell this people the other day. I had a lady who works every single day. She doesn't have any time off, and I get that some people aren't able to have any day off, but I think that if you can work 6 days and take a day off, I think it allows you to be stronger and more energetic on the days that you do work. And it's, even though it might be, you feel like it's selfish to take a day off, it's actually, to me, selfless, because you actually are able to provide for other people better because you have the energy and that you're filled up better. So it's kind of like take a day for yourself. To me, you need to do that.
See, Tracy 70204, a fan from Taiwan. Hi.
Wow, thank you for coming, Tracy.
And then that's a good one. Tennyson K. So maybe read that one.
I probably close my eyes, just helps me think. It just takes, like right now, it takes the visual distractions out of the equation and allows you to just focus on the words to be as clear and concise as you want to be versus focusing on what you're seeing. Many times I'm visualizing the bone. So if I'm feeling someone's neck, they do teach in school, and my dad taught me more specifically to visualize the adjustment, visualize the bone, visualize what you're trying to do, visualize the force into the area that you're trying to loosen. And I think it helps you do a better adjustment if you can sort of picture the bone. So that's kind of why I close my eyes. It's a sort of habit at this point, but I see one question, ice versus heat. I think I saw that. Yeah. Helene Shoup. So generally the textbook would say first 72 hours in the acute phase, you don't want to use ice. So you sprain an ankle, you bust a finger, just anything, a cut. I had a wasp sting me a couple of years ago and it was killing me and I just got ice on it, took the pain away. I would stop icing, it would start hurting again. I just kept icing it. After maybe 45 minutes, the pain was gone. But you want to, sort of calm down that acute swelling. What that does is the acute phase swelling actually can, if it's too much swelling, it causes the wound to get torn open larger. So it actually makes the wound takes the recovery time longer if you don't get ice on the acute phase. So first 72 hours, especially before the first sleep cycle, it's the most important to get ice. Pretty much anything, whiplash, sprained ankles, you want to ice during the acute phase. Heat can be great on areas that are frozen. So many of the areas that I'm trying to loosen, I'll put heat on. If patients come in my office, I'll put a heating pad on their middle backs or their upper neck to help loosen up and prep that area a little bit. And there's a way I have that with some of my Denarolls to help put the heat where I want it and not putting heat where I don't want it. And but generally you don't want to put heat on any acute injury. And then anything after 72 hours, you can more or less use ice or heat. It doesn't usually change physiology that much where you're going to hurt anything.
Yeah, maybe. Let's see. Go ahead and read the question because some people aren't seeing where they are. So this is a nice comment.
Is it you've been to a concert? I just want you to know that you're such a beam of energy and you are an amazing individual. I hope you are an amazing day. And I know that your videos help with my anxiety. I really appreciate that. I do read not all the comments, but my wife and I try to read most of the comments and I really appreciate just everybody's support. Really thankful. Thank you so much.
Melissa, you and your sister should do more videos together. I love your family.
Coming up soon. We do have something in the works.
Actually, yes. It will be coming soon, hopefully. Next week, we're going to be visiting Brenda.
Yeah. It's her birthday soon, so that's what she wanted.
I wanted him to do a video. Let's see. Just make sure you read it so they can hear who you're talking to. How do you... Is this wifey too?
How do you not get mad at people? I like that question.
Read it out loud.
So is it no?
No.
So it doesn't. It never.
No, read it out loud.
No. He says, how do you not get mad easily at people? So I got into this profession to help people, and I don't see how it ever benefits if somebody doesn't understand something I'm saying. It's usually my fault. I haven't done a good job of explaining. It's not their fault. Many people in pain are sometimes not in a great mood, and that's why they're here to see me. I'm here to help people, and it's the most rewarding thing to see a patient come in. I've had people crawl in or be carried in, and just helping people is really, really just. There was a chiropractor in my school who was actually in his late 40s, and he had been a pharmacist for 25 years, and he was a great guy. And he said he had helped a lot of people in pharmacy, but he said he wanted to be a chiropractor because it was just a different way of helping people that he just really wanted to do. And with pharmacy, he sometimes saw people taking more and more medication. With chiropractic, we try to allow for freedom, allow people to not have to be emboldened to something. I know you might say you like get emboldened to the Denaroll, but it's a lot of, it's really a patient being equipped almost like a toothbrush so that you can take care of yourself. You're not needing to come in so many times for care.
This was from someone. Thank you.
Siempre, I know was always what.
I can't read the rest of it.
So sorry.
Yeah, but thank you.
Spanish is terrible. I really appreciate that. Thank you. Will Dr. Max be in it? I hope so. He will be.
If we have anything
nearby,
to say about it, he will.
I'm going to be grabbing him.
There.
And Dr. Max should be in the video. He's working on his boards currently, and he's doing really well. He's got a little bit more to do, and you should be seeing more of him as he finishes his boards and gets his license. So, what's my son? I have two sons. They're Ethan, who's 7, and Charlie, who's 19 months.
Yeah.
And
Just make sure you read the question.
I'm sorry.
So they know.
Vagabond, love it. I was like, Vegas.
This is a good question. Helene, read that one.
Helene says, how do you know when back is prepared enough for the foam roller stretching? Very good question, without injuring more. So the roller is a little bit safer to use for a person that's not under chiropractic care because of its contact. Generally, the contact on the roller is going to be more broad. The DentaRoll is going to be much more pinpoint, which, because it's more pinpoint, it's more effective at stretching a smaller area. And then when you move it around, you get a deeper stretch in a smaller zone. The rollers are more broad contact. I would say for a large percentage of people, it's probably safe to be able to use a roller. Again, you should have somebody check your spine, make sure it's not totally locked. Sometimes if your back is very stiff and you're on your back on, say, your middle back, if your neck bends too much, that isn't good for your neck. If anything goes down your arms, or if your hands are going numb or tingling, you should stop. So you definitely want to have your spine loosened up before you use a roller. But in general, the roller, that's why they sell them at Walmart and Target. They sell them because they're a little bit safer for a layperson to use. Hope that helps. Difference between a chiropractor and osteopath. So I think it's Andrew Still started osteopathy in about maybe 20 years before chiropractic. These are good history questions that I probably need to fully buff myself on. So the gist is that Andrew Still believed that it was blood flow was the problem. And the chiropractor, D.D. Palmer, believed that it was nerve flow. And that's a very basic way of looking at it. They sort of had disagreements back then. Andrew Still believed that D.D. Palmer stole chiropractic from osteopathy. My opinion would be that chiropractic tries to focus pressure more in an area versus a manipulation. We use the word adjustment. The word subluxation is more used in chiropractic, meaning that there's a bone out of place. I don't particularly like the word because chiropractors commonly think or try to teach that the adjustment changes subluxations, where enough research had come out to show that only stretching can change subluxations, that the position of the bones can only be changed through stretching. And so generally osteopaths are obviously, they're medical doctors. Chiropractors are not medical doctors, meaning we don't prescribe drugs. We don't do any surgeries. Osteopaths, I think, are able to do some of that.
Here's a question.
Good question there, Mike. I really appreciate that. Thank you, Mike. Is it necessary to take an x-ray before visiting a chiropractor? So if you would, my father is much more, I would call, orthodox or like more old school. My dad likes to see an x-ray before he adjusts. I like MRIs just personally. I think you see a lot more information.
But do you have to have one to be treated?
Most people, I would say no. And the reason why I say that is because we see a lot of similar wear patterns whereby the lower neck is usually worn out, the lower back is worn out. And so in school, they teach that imaging is used to confirm a diagnosis. So you're not just supposed to take imaging or even blood tests or any test. You're not just supposed to wing it and just patient comes in, talk to them, run a bunch of tests. You're supposed to have a fairly good idea of what's going on. And then you use imaging, x-rays, MRIs, blood tests to validate what you already know to be true. So when I send a patient for an MRI, I already know there's a disc injury. I'm using it to help the patient understand so they can show their family. And sometimes people don't fully are on board with what they've been injured. And so the MRI just helps to show the disc. The x-ray, you don't really see the disc. It shows more of alignment issues. There's a lot of usefulness with the x-ray, but you get some radiation. They used to cost a lot less. So you did x-rays because MRIs cost a lot. Now MRIs have come down in price. So I hope that helps. Wow. Really appreciate it. Spur marks, $10. Wow. Thank you. I love watching you and your sister Brenda video. Relaxed me just watching. I really appreciate that, Spur. Thank you. Thank you for the support. Oh, geez.
Thanks, Jamie.
You got outdone, Jamie. 1 cent. What is? Come on, man. What is?
That's funny. Oh, how are you? What happened? Is this?
I think it just takes you where.
I don't know. Okay, am I down?
What is that one question?
I don't know. Hang on. Hi, happy Al.
Oh, this might be somebody that knows her.
Hi, sister. I love you. Aw, I'm not sure who that is.
Okay, Jacqueline says, what do you recommend we look for in a chiropractor? One of the questions I'll ask people, I try to tell people when they're going to a new area to find a chiropractor, one question you can ask is just call the office and say what therapies are performed in the office. And they might list off a lot of therapy, lasers, electrical pads, inversion tables, machines, and which is not necessarily a turnoff. I would just then ask, do you guys do any massage? Do you do any soft tissue work, fascia blasting, cupping, gua sha? You're trying to look, what does the office offer? And then another question you can ask is, can I observe an adjustment? This is before you've even gone into the office. Say, is the office comfortable with me coming in and just observing? If somebody asked me that question, I would adjust my father in front of you. My wife has come in. I've had come in on the weekends, and my children. I had a woman once who had a 1-year-old. She was so concerned about her child being adjusted. I think they had an ear infection, and I came in with. And I brought Ethan in and adjusted the baby for this, so she could see what a child adjustment looked like, just to help her and at ease. And the child did wonderful. The ear, I think, did a lot better. But so. Can you observe an adjustment? An office shouldn't be so closed-minded that they're like, no, we're not going to let you see anything. I think it's okay for people to kind of know, and YouTube obviously opens that up to allow you to see what I do. And so can you observe an adjustment? Is there a lot of therapy? If they only list a lot of therapy, then that's probably what you're going to get. I think, again, going back to what I said earlier, a lot of chiropractors I call it like set it and forget it. They're not doing a lot of hands-on work. Chiro means hand. So it's supposed to be hands-on care. Chiropractor means hand practitioner. So if there's a lot of gadgets, it does list a little bit of yellow flag to me.
Here's a nice comment. Melissa.
Lacey, you and your sister make me laugh. You guys are really good siblings. Oh, thank you so much. No, Brenda was the boss growing up. We went to school together a lot. We were homeschooled. We were really only 16 months apart. So we went to Eckerd College together. She was a year ahead of me, but we took many classes together: organic chemistry, physics, biochemistry. And so people thought we were, of course, married. During roll, it'd be like, Brenda McLaughlin, Edward McLaughlin, well, here, So people always like, what? It's my sibling. It's okay. So yeah, Brenda and I went to school together. She's really she really would work really hard. I would always try to, bring her down a little bit in terms of, she would overstudy for everything. Brenda was I would kind of just.
Chicky Katie never would have guessed she was the boss.
Yeah,
She's older.
She was.
But can you, Maria? But can you tap?
I did tap for a couple of years. Yes, there are videos that will
need to do
at some point
YouTube.
they're out there, but they're not uploaded. But yes, I did tap for I think at least 2 or 3 years. At a very young age.
Joseph Carlson, is your technique taught in school?
So
you need to teach it to people.
So Agraston is an elective that they teach at the school, which uses the metal instruments, very similar to gua sha. But when I took the elective in college, it was much more mild than I'm comfortable with.
His technique's not taught.
They don't teach my technique, but the foundation of the adjustments, the neck adjustments, different modifications, different things I do. The roller's not taught. There's a lot of some things that I do, like for instance, the hug adjustment, I call it when I'm doing the thoracic cage. That adjustment that way is easy on me and the patient. It uses sort of both of our body weights to get the bones to move. There are other ones called double transverse, double thenar, are other ways of getting the thoracic cage to move. And it just puts a lot of stress on the wrist. So, I have to sort of, the wrist, that's the first year of learning chiropractic is you sprain your wrist all the time. So when you're adjusting, you can't let your wrist ulnar deviate. So when you'll see me when I'm adjusting, I lock. My dad would teach it as this is one piece. So if you all laid down, I started teaching how to adjust. This is a 90-degree angle and one piece. And when you're adjusting, there is no, the wrist is completely locked. So you do sprain your wrist a lot in the first year of adjusting a lot because you are poor in your technique and you let your wrist ulnar deviate, we call it.
Okay.
Can ribs be individually adjusted? Let me see. Brebat. Can ribs be individually adjusted, and why would they need adjustment? So posture changes the positions of the ribs. So they kind of describe it in school as a bucket handle. As the rib starts to raise up, it's like a bucket handle. So it goes from up, and then it kind of can go to the other side. So it can get stuck in the up position. So we're trying to get the rib back down. Every time you take a deep breath in, the rib rises up, and then the ligament, pulls it back down. Many times because of posture, our ribs get stuck in the up position. That's makes breathing easier because the ribs up all the time. It's like opening and shutting a drawer in your kitchen. Maybe you might think, why ever shut your drawers in your kitchen? You might just leave them open so you can just grab stuff easily. Well, now you're banging into stuff. So if the rib stays in the upper position, the nerve gets inflamed. It causes pain, inflammation, tight muscles. So can you adjust one rib? I don't think so. Maybe, they've done studies where chiropractors with very specific techniques try to move just one bone. No matter what, you're going to move the vertebrae above and below. So it's always 3 at the very least. Most likely 6 is what I've seen. But you're really just trying to push the ribs down to take stress off the muscles, take stress off the nerves. So,
Edith.
Wow, Edith, thank you so much for the support. He asks, is chiropractic continuous?
Edith, I'm not sure. Yeah, sorry.
Is chiropractic continuous? So, what do you think? It's a way of life, but I'm not sure if I understand completely.
Like forever, probably.
Oh, okay.
Or what does it look like?
So it's a way of life. It's how I would say that your spinal health is your health. Our world separates health. Maybe if I asked you how do you determine how healthy a person is, somebody might say, well, what do you eat, or give me a blood test, or take a picture of the spine. I would argue that having a clean spinal column, having the right posture, having all the parts moving in your spinal column, it not being sore. So when you rub your back, there shouldn't be tension. There shouldn't be soreness. So in order to keep the spinal column clean, adjustments are a way to clean the spine, to help you stretch, maintain good posture. And yes, to some degree, you can take care of that as yourself as a patient. You don't need constant chiropractic care. I think there's a fallacy. Sometimes people believe they have to go 3 times a week the rest of their life. I really don't. It's really not good that that's being taught. I want to equip people with tools so that they can take care of themselves. Initially, yes, you need to, I call it like boot camp, getting through my office, getting adjusted, getting to a place where you can take care of yourself and not need constant care. So a lot of my patients that are in my office for more than, through the first 8-10 visits, I give them a much longer leash. They're doing their stretches. But yes, to some degree, like your dental hygienist, you can't just, see you later, dental hygienist, never need to get my teeth cleaned again.
Yeah, but you're about teaching people to know when they need to come back in, how to stay safe, how to make it a more permanent part of their life without having to be there every week.
Once you get, the vertebrae are supposed to be self-cleaning based on mobility. So once you get things moving, the spine stays cleaner. You're able to stretch. You're able to take care of your spine better. And I know a lot of people that are traveling. I try to tell them when they get back where they live to try to find somebody that can at least work on. I had a patient today. I said, don't tell them about where you're injured. Just tell them your middle back feels tight. Tell them your upper neck feels tight. Try to help find somebody that can further your care without, everybody wants to work on the effects. Wow.
I want to say it.
Thank you so much.
Why?
What is that? You're amazing. I really appreciate
Yeah.
that. Thank you.
Yeah. Oh, thank you. I can't say your name correctly. Darn it. But thank you for that.
Really appreciate that. Thank you
$50.
so much for the
Wow.
support.
Thank you. So kind. Oh, another Savannah. When are we going to see you and Dr. Mondragon again? Love you and your sister.
It's coming
We're
soon.
coming soon.
We're working on it. It's
Yes.
going to be
Hopefully very
hopefully
soon.
very soon.
We're
but
going
we'll have
for
some fun.
a visit to Orlando this week to see Brenda.
Yeah.
So. Aw. Ethan, thank you.
Ethan's
Our son's name is
my
Ethan.
son's name is Ethan. I really appreciate
Your
and
wife is beautiful.
hold on. Ethan James. That's actually his first and
Is
middle
he
name.
on
So
the internet? No.
Ethan, are you upstairs?
Just kidding.
It's your mom.
I don't think he knows how to do this. So he's only 7. Anyways, that's sweet.
I find that I crack and click more day to day. So untame your phalanges. Can too much adjusting weaken you? I find that I crack and click more day to day since seeing
Where's
chiro
that
regularly.
from?
It's not a problem, just an observation. So I would say that you can't be over adjusted in where you're tight. So you absolutely can be over adjusted in the parts of the spine that are injured or the parts of the spine that are inflamed or hypermobile. This is where you need somebody who can identify where.
Focus.
What?
Ethan, my dad's name is Ed. Too many coincidences here.
You definitely can be over adjusted in the parts that are hypermobile. The difficulty when you're learning, if everybody here was with me right now and I tried to show you guys how to adjust, the first bones that you would adjust would be the loose ones. So when you're a young chiropractor learning how to adjust, it's easy to adjust what's loose, and the skill and the time it takes time. My dad would look at me and, since I was 13, when I first started learning how to adjust, he is very drill sergeant, not too much rotation, not enough P-Day. My dad really would be very picky on Brenda and I on how we adjusted. And so it is tough for me to sometimes watch other chiropractors adjust because it's like, they're either, so for instance, in the neck adjustment, you'll see we keep the chins up. We're trying to actually help draw the curve into the neck. Sometimes you can get a louder click by bringing the chin down. And it's not just about the sound of the click. We're trying to close the joint. So it's easy to get loud clicks and easier to pop the loose joints when you're first learning how to adjust.
That's how you say it. Yagi.
Is it Yagiyu?
Yagiyu.
Yagiyu.
Maybe that's how we say it. But thank you
Really
for your
appreciate that.
gift. Yes.
So I hope that answers that. I think I saw one there. I'd like to see that question.
Oh.
I thought I saw it. Is moderate to severe cervical stenosis, and I like these medical questions, yes.
Just make sure. Can everyone hear him okay?
I think I tested it.
Okay. You sound quiet.
All right. Is moderate to severe cervical stenosis in C67 permanent, or can it be made better, almost normal with chiropractic? So this is Brebat 56 asks. So I think of it like a cracked tooth. If you have an injured tooth in your mouth, there is no way to undo a cracked tooth. The best way I would treat that is twofold. One, that part of the neck is supposed to be used at the end of your range of motion. So when you turn your neck, C1 is supposed to do 45 degrees each way. So from here to 45, the only bone that's supposed to move in normal biomechanics is C1. And then past 45 degrees, you then recruit the lower segments. So it shouldn't be possible to wear out C6 and 7. C6 and 7 are supposed to work right here at the end of your range of motion. So the loss of curve, forward head posture allowed the lower neck to degenerate. And by restoring the posture, by getting the upper neck loose, by essentially chewing on the other teeth in your mouth. So if you have a couple teeth that are cracked, my answer would be to chew on the other teeth that are not injured. So you can rehydrate discs a little bit, briefly to answer that question. But I think of it like the bone spurs grow due to mechanical overuse. So can you make a muscle smaller? Well, to stop using the muscle so much. So yes, to some degree, some of that bone spurring. I've had patients where I had a 48-year-old MRI, 56-year-old MRI, same patient, and some of those bone spurs and discs, the discs got rehydrated, the bone spurs shrunk a little bit. By changing the posture, you can reverse it a little bit. I think the best way to think about it would be, how did you feel 10 years ago, 10, 15 years ago? And that's where we're going to lock you in the rest of your life. So if you have severe lower neck stenosis, I can't make you feel 18 again. Like say if you're 50, 55 years old and you have severe stenosis, I can make you feel like you felt at 40. And I hope 40 wasn't too bad, but I can't make you feel 18 again. That's probably outside of what we call the limitations of matter, but we definitely can improve your quality of life and how you feel. And I think the best answer is to say that we're going to teach you to not utilize the lower neck that's injured. Wow. Again.
Is it him? Yeah.
Thank you so much.
Yagi,
thank you so much.
you.
Been watching your channel, and your sister, 1-2 every day. Was skeptic about chiro, but the way you explain it, it is both so entertaining and relaxing. Please do more live streams. Oh, wow. Really appreciate that. Thank you.
I've been trying to get him to live stream for a little while now. He finally did it.
My sister was the stage person, guys. Okay, I was the one in the back doing the rails. Okay,
but you're funny. He's funny.
So
he's shy.
I was 14. I think Brenda was 16. She did a show called Carnival. She was the lead in Carnival, and this was at the Players Theater here in Sarasota. And I was in the background. I did like the rails where they, if I let go of one of the ropes, something might fall. They're on my line.
Zen's Way 5. Thank you. Let's see if you can address that one.
Zen's Way says, not sure if you've answered this question yet, but I can hear and feel my shoulder pop whenever I move it, especially when I work out. Is this normal? Okay, so you need to have this evaluated to identify what exactly is popping. Without examining you, I would first recommend seeing a professional. Just more broadly, one of the things that can pop is the tendons. So if the shoulder is forward, the tendons that are around the shoulder are held taut like guitar strings. And then when you move your shoulder, you're simply just moving the bone over those cables. The cables are pretty tough, but over time, it'll cause tendonitis, inflammation. It isn't good that if it's repetitively clicking like that, then you're going to be irritating or inflaming the tendons at the very least. That's most likely what I see the more often is the cause. You can have, obviously, the bone, the humerus sits in the glenoid fossa, and it's supposed to be in the middle. Sometimes if the shoulder's forward or not in the right position, you can be grinding on a lip, and that can be causing some sounds. But generally, you want to get the shoulder seated properly where there's the most cartilage in the glenoid fossa. So
it's Yag-U.
I'm so sorry. Yag-U.
Oh, sorry. Thank you for making it easier. Thank you again. That was very kind. So what did Happy Al say? You
are obsessed with teeth. What? Tonight, oh, well.
Your analogy.
I think this is Jeremy Clarkson. Maybe I shouldn't be.
Jeremy, what are you going to say? Who whispered in my ear first? Just kidding.
He says, what is he? I think he says, what do you call a person with, clean teeth or something like that in the American?
Oh, stop.
Sorry. It's Jeremy Clarkson.
You're funny. Oh, this is a question.
Bobby Taylor says, so how do I find a DC near me that practices similar to you?
You get this question a lot.
Yeah. It's
he's in Dallas, Texas, similar to you or your sister.
I would, you want to try to get your information before having to walk in the office, because there are chiropractors that you can locate that will do the postural work. So the website is idealspine.com. is the chiropractic biophysics website. So there are guys that are going to be nerdier, believe it or not, than me, that all they care about is getting the curve in the neck, curve in the lower back. You can sort of start with that. So there's a doctor finder on there. Dr. Ed, why aren't you on there? You have to continually go to their seminars. If you stop going in about 6 months or a year, they'll take you off the list. So we were on there, and then like I said, if you don't actively go every year to their seminars, they'll take you off. But you can go on there there's a doctor finder on chiropractic biophysics. They're at least going to be posturally minded. That doesn't mean they'll do the soft tissue work. You can start with them, call them up, say, hey, do you guys do any soft tissue work? Do you do anything, hands-on? Do you have a massage therapist? I usually ask, what kind of therapy do you have? Do you have lasers, electrical pads? I personally like more hands-on work. And then another question you can ask is just, can I observe an adjustment? So you just ask on the phone, can I observe?
Yeah. It's hard
care
to find,
before?
though, people that do exactly, because it's really comes from your dad.
Come to Sarasota.
It's hard. It's hard.
Sorry.
Oh, good night. Happy Al. Night night.
All right. Good night. Yagi says, would you ever do a second episode of the Gua Sha compilation? I've been watching it over and over because there's nothing else like it on YouTube.
Oh, maybe. Yeah.
Steve, be on the lookout then.
One day.
There probably will be. Thank you.
2 feet and 2. Hi, Dr. Ed. Great information. Hi. Let's see. Oh.
Has your practice grown since YouTube? I think this is a question from Maria. Do students come and shadow you? I had one guy that was going to chiropractic college come in, and he had a lot of good questions, and we talked quite a bit. But I definitely, people are able to find me a lot more now. So I still like to have my regular practice. I'm trying to balance seeing local people here to Sarasota and not get too overwhelmed, and still provide the care that I want to do and help people. That's really, if I can't help people, then, that's why I do this. And so if I can't, changing people's lives is what's so cool about my job. It's really, really fun to have people come in and just tell me, Ed, I can't believe how much my back is different, how, the things that I came in with, I don't even feel anymore. I can, and then I have lots of golfers that come in. I'm hitting the ball 30 yards farther. Oh, jeez. But yes, if that's what you're into. But Crickswag says, what do you think about spinal decompression? And do you think it can be so effective treatment for neck and back pain?
Thank you for the donation.
Thank you so much.
Too.
Yeah. Spinal decompression. So this is generally, most common would be inversion, or just pulling the spine, straight traction. So when you see me tractioning out, somebody will be on the back and I'm pulling on their neck. I'm not doing a real, thrusting traction. I'm just sort of holding. I'm trying to unlock the vertebrae. So it's okay to do a little traction to open up the vertebrae. I'm not trying to stretch somebody when I'm doing, we call it positive Y traction. So I'm not trying to stretch them. The discs are glued. So the complicated answer would be the discs are glued to the end plate. So when you traction the spine, if there are tears in the annulus of the disc, you're going to gape them. So I think of it like a cut on your skin. Is it a good idea to gape it? The issue is that the disc doesn't have any feeling, so it doesn't hurt. And so this is where a lot of chiropractors will do spinal decompression. And if I will do it sometimes, again, a person that's older, it's generally safer because the discs are dried out a little bit. A person in their 20s, 30s, and 40s, I would be very careful with doing a lot of traction on them, straight, upward traction, because if they have disc injuries, the potential to hurt the disc is higher. The older the patient is, and if you're just trying to get some relief, it's okay to do. We have some over-the-door tractions in my office that I'll use just in emergency situations. But the other thing with traction is that when you're tractioning, you're mainly tractioning what's already loose, so you can further imbalance the spine. So say if the upper neck is really tight, the lower neck is really loose, and then you traction the spine, you're only tractioning what's already loose. So you got to be careful. It'll feel good while you're being tractioned, but then after you're done, you might have just loosened your lower neck more, and so it kind of comes back and leaves you with a not a really good feeling. So if you say effective treatment, a lot of chiropractors might say that effective treatment is just something that makes people feel better. So if that's what we're trying to accomplish, then possibly. But just feeling better temporarily is not what I'm trying to do. I want to help person feel better in a much longer. So I would believe in extension traction. So not just straight upward traction, it's traction with molding the curve in the spine. That can be performed with the Deneroll, with arching back. We're trying to rehydrate the disc and put the curve back in the spine. So not just positive or inversion tractioning. Hope that helps.
Someone asked, I can't find it, if your dad would ever make an appearance. Oh, wait, here. V. Howdy, you've mentioned your father many times in videos. Any chance he'll ever appear in a video?
Dad, there is a video floating. I think it's, did he take it down? I think it's on his website.
He says he doesn't want to.
He's a little camera shy. I don't know how we get Dad on there.
Right now, he says he doesn't want to, but we'll work on him.
He's just a little self-conscious.
I think I'm behind. Okay.
So, is it Philip that says, I'm an LMT and I love your videos. I'm sending clients to chiros all the time. What benefit reasons should I cite while recommending chiro to clients? Again, without knowing what the chiropractor does, or having a, relationship with the chiro, it's tough. Generally, chiropractic is, we're trying to, I would say we're trying to balance the spine. Some chiropractors have gotten a little bit too much into just trying to make people feel better without permanently helping people. I hope. So, postural chiropractors are what you're trying to locate. People that are interested in restoring the lordosis in the neck, getting the ear over the shoulder, sort of like orthodontistry to it. I think I know people always say, stop using dental analogies, but
they're good analogies.
It helps because people pretty much got dentistry down. We know we have to participate to clean our teeth. We know that the alignment of the teeth matters. Whether you believe it or not, everybody understands that if your teeth are crooked, they're going to age unevenly. It's the same thing with the spine. If your posture isn't aligned properly, your spine will age unevenly. So that's it. You have to help aim the person back into the right posture.
That's a good question. Millennial Smart. Mm-hmm. Go ahead and read it.
It says, good evening. What is the adjustment called when you lift the upper body from the elbows or forearms and push down the back? Maybe a compilation. They don't teach this. This is something my father has taught my sister and I call it the bow adjustment because, well, one, it's taught by my father, Dr. Bow, and it kind of looks like you're, bowing the spine. And so it is I call it an extension adjustment. You're instead of most adjustments are done in neutral. You're just laying face down or you're face up and you're in a neutral position. A more advanced adjustment would be to actually take the person into the mirror image and adjust them in the mirror image. So if you have a hyperkyphosis of your upper back and we adjust a person in neutral, you might be getting them close to where there should be, but you're still not, the kyphotic curve is larger than it's supposed to be. So when you arch someone back, you're actually reducing the kyphosis and then you're adjusting them, which just allows the adjustment to be much deeper. You need to be, not everybody I work on I will do that. As I'm examining and assessing a patient, I'll determine if it's something that it can be done safely and effectively on them and not hurt them. You have to be sure that the whole spine is working evenly. The ability to continue to stress parts that are overworked is higher when you do a deep adjustment. So just generally, I would, 6-8 visits is a good number for me to even begin a bow adjustment, unless, like I said, I know the person's flexible enough and I've evaluated that. I've spent enough time on them. Not always, but it's just a deeper adjustment.
Marion, is that how you say it?
Marion says, hope to come visit you someday. You are fantastic. Well, I appreciate it. My question is, do you want to use the Deneroll after getting adjusted, or can you start using it without it? So it depends on the person. So if your spine is limber enough, if you've done yoga, or if your spine is limber enough that you can safely bend evenly, then you can use the Deneroll. My official answer would be no. You should be evaluated by a chiropractor to make sure that your neck is working evenly before you do. So many of the Deneroll devices will have a disclaimer. Make sure you're under direct supervision. You wouldn't just start trying to move your teeth on your own. I had an orthodontist. You have, the orthodontist does it, and then you're under their direction. So the Deneroll is a powerful device. That's why you have to get it through a chiropractor because you need to be under their supervision. So the Deneroll is just, there's a Deneroll pillow now. It's really, I think I got her using it finally a couple months ago.
Oh, that's great.
Pretty cool. The neck, I don't really do the neck device outside of the pillow. The pillow has a zipper on it, and then you actually put the orthotic into the pillow, and then you sleep on it, and it's just it's pretty amazing. So, no, thank you, Gary.
Gary, thank you. Let's see.
Yagu says, you should do a workshop panel, write a book about your knowledge.
I've been telling him to write a book.
I've been working on something. I got a couple pages of stuff. It's a history.
One day, eventually. That's a good question. I don't know. Let's see. Where's that one?
So there's one that says, is it good to get, Zamira says, is it good to get braces at a young age? So if it's spinal braces or if you're talking about teeth braces, I'm not a dentist. I don't. I think I was told that some of the roots of my bottom teeth are a little shorter than they're supposed to be. Again, I'm not a dentist.
Like teeth?
So I think orthodontic braces, sometimes if you get them too young, the roots don't have enough time to grow. Again, check with your orthodontist, but I think they want to. But if you're talking about spinal bracing of the spine, like say if you have a scoliosis, that's a deep question to answer that one if that's what you're asking. So scoliosis is demonized a lot, but many times a scoliosis, if it's a structural scoliosis, so there's two types of scoliosis, functional and structural. Structural scoliosis, I would argue that it needs to be there. Sometimes it's larger than it needs to be, and we feed it. And take me a while to answer that question, but I wouldn't agree with putting braces on the spine unless it's some very severe cases maybe, but I think a lot of it can be reduced through more conservative care.
This one. Can you read? Yeah, read it out loud. I don't. Sgon
says, after noticing your latest Instagram, I appreciate it. Were you ever a big rock metal fan in your early years? Nirvana happens to be one of my favorite bands. I remember being fairly young and being at a friend's house, and his older brother was playing Nirvana. It was my first time hearing, I think it was the Nevermind album. And I was like, whoa, that's just different. And so, I've always been a Nirvana, and then obviously Foo Fighters. And, but obviously with kids now, I do make them listen to a little bit of it, but I still love Nirvana. I actually have a chirp wheel. Don't we have? That's what we have in the office. The chirp wheel. Yeah, the chirp wheels are fine.
Which one is that?
It says, Philip says, ever seen a chirp wheel ad? It's a spinal wheel with multiple sizes. What are your thoughts on these? Assuming they're used correctly. It's a good way to loosen the spine. It's kind of like what would be a good way to talk about it? Kind of a broad way of just hydrating the spine. Again, you should be loosened up first. Even the chirp wheels maybe a little bit more intense than. I like the smallest one. I think there's like the one that I have is 3 different sizes. I like this. I think the smallest one I like the best.
You did a story about it once, but not a reel. So you liked the little one.
Yeah, it's good. It's a good. I look at the rollers and the chirp wheels as massage devices. I really don't look at them so much as stretching devices. They're used to loosen the spine. So say if you're going to go play golf or go do something physically active, I would use a roller just to go through the spine, loosen up the spine, get it all working so that when you're doing that activity, your whole spine's working. But when it comes to changing posture, the contact is too broad. If you feel that when you're on the chirp wheel versus a Deneroll, you'll feel that the pressure is much more broad. And so it just doesn't give that focused stretch that I'm looking for to change posture.
Gary Manuel, I've been subscribed since you had 10,000. Oh, wow. It's so nice to talk to you. I hope you have a nice day.
Thank you, Gary, so much. Appreciate that. You've been loyal follower for a while. Appreciate that.
How about Craig H? Read that one.
Are you a big gamer? Heard one of you to play. Yes, I am playing D2 Resurrected. It's in 7 days, right? 7 days. Thursday, I think next week. I think it's 8 p.m.
I've lost him. There's so much.
Gonna lose me.
games.
That's something
He
I don't.
loves games.
I try to hide. I've been playing Diablo 2 for way too many years, and so
I played
is-
it too. Once.
Yes, Diablo 3 when they had the real money auction house.
Yeah.
I would come home one night and the kids were
Love
being
it.
neglected, and the light from the monitor was on my wife's face.
No,
And-
they weren't neglected.
Well, they were. Carlin, get
I
off!
was earning money.
Get off the game, Carlin. The kids need to go to bed.
He loves.
Because I actually like to play, and she
I
was
like to
playing
earn.
because she could, find items to sell them. But I was like, I actually enjoy playing this. So, yeah, I've been a gamer, so for a while, but PC gamer mainly. Obviously as a kid, I had a Super Nintendo, Genesis, Sega CD, Dreamcast, PlayStation. I actually worked at an electronics boutique before it was GameStop. I worked there for 2 years when I was an undergrad. Then I worked at an ice cream store that my brother also worked at.
Cool.
So what's your wife's name? Does she do all the editing? We both work on the editing. We both she does quite a bit. She's getting really good at it.
It's a team effort.
It's a team effort, but sometimes she'll ask me, "Do you like this?" And sometimes I'll say I wasn't as concise, or I didn't word it exactly, how I want it to be worded. And so sometimes we'll cut things out that that I think I could have said better. And so next time we make a video, I'll try to say it the best way that I think makes the most sense.
We try to work on it together, but I do a lot. And my name is Carlin. Hi. I think she's on Instagram too.
One time we were.
Do you follow on Instagram, Maria? I think we recognize your name possibly from there.
My favorite story was we were at Universal Studios, and on that ET ride, when you get on the ET ride, they want to know your name. I guess when you're leaving, when you exit the ride the ET ride at Universal, they're like, goodbye, Edward, goodbye, Carlin, and the lady that works there, that literally her job is to put people's names into the computer. Remember, she was like, "What's your name?" And you're like, "Carlin." She's like, KCIR.
Oh yeah.
Anyways,
I get Carolyn, Carmen. It's spelled differently. It's Karlyn. All right, let's see.
Get some water back.
I'll be right back. Just me. I can answer that, Angel. His Instagram is Dred. It's Dr. Ed McLaughlin, but it's spelled DRED McLaughlin. So that's what it is. Let's see if I can answer anymore. He's getting water. He's getting a drink of water.
I'll fill in for him.
Oh, cool, Maria. I see your thumbs up. Awesome. Oh, hi.
Oh, darn, Dad's coming back.
Jennifer M., is your clinic near your sister's clinic? No, she's in Orlando and he is in Sarasota. So it's not too far, about 2 hours. But this one,
Alex says, "How long are you a chiropractor?" I started in June of 2007 was when I started my internship with my father. But again, I started learning how to adjust when I was a kid, and it's been a lot longer than that. Embarrassing story. Hurry, I like that one.
Which one? Oh, embarrassing story.
Embarrassing story.
Who's that from? Chicky, KT.
I'll think about it. I'll think about that. I'm sure it'll come to me. It's got too many of those.
Think of one because that would be funny. How about this one? Or well,
What is the best sleeping position? Says MBT. The back, being on your spine, on your back would be ideal. The side generally we go to avoid problems. So you'll rotate to your side to get away from something that hurts.
Vagabond. She looks like her mom on the left. This is Anna. You need to go upstairs. You want to say goodbye?
Bye.
You're funny.
So on your back, the worst would be stomach with your head turned all the way. Sorry for any stomach sleepers that love that. So when you turn your neck past 45 degrees, the neck goes completely straight. So essentially, if you sleep with your head turned or tilted, at the end of its range of motion, you're pulling the curve out of your spine, which then creates that mechanical imbalance where parts of the spine age unevenly. So then you're stretching the curve out of your spine.
Read, I guess, who it's from.
Do you have any suggestions for
Sam.
Sam
Sam.
Sarna says, do you have any suggestions for desk chairs in regard to posture as someone who works on the computer all day?
Show them what you do.
So
I can't see it. Can I?
I'm not doing it right now. Sorry. People been looking at me,
Yeah. It's backwards.
and I'm just like, "What you looking at, stranger?" So you try to
We have
sit,
an Instagram about it.
try to want to sit backwards on the chair, and the idea is to get as much curve. It allows you to hold your head upright more. There's more arch in your spine. Not the whole time you're sitting or working, but just intermittently. I would get a chair with a lower back. This is too high, but the back would be lower, and that you actually can put it into your abdomen, and then try to arch your back. You're almost trying to lay down. Again, it's about having a variety of positions. If you work sitting for long times, you want to not just be locked into one position. That's where most of the problems come from, where if you have no lumbar support, that curve goes straight. All the work goes down to L4 and L5, hence why 99% of surgery is L4 and L5. I would say Dune. I like Dune. I've actually read Frank Herbert's Dune. That was a
So what
like-
is that? R333 Dune or No Way Home?
yeah. I like Dune. I even like the old '80s one with Patrick Stewart, which I know it's not that great of a movie, but I watched it at a young age, and I kind of a little bit of a soft spot for that movie. But, I like Dune.
LVRNC. Thank you for the donation. Do you want to read that one? It's a donation. Thank you.
Thank you so much. What's the difference with the elbow work you do and a regular massage? It looks pretty painful, but it also looks more helpful. So when people will ask me sometimes, are you massaging my muscles? And while obviously you can't not massage some muscles, there's muscles in between the surface and the joints underneath that I'm trying to access. So when you see me pressing very hard, I'm trying to loosen up the actual joints. The joints are like handshakes. And so on the surface of the joint that's been frozen, there'll be plaque, crystals, sandpaper. And so we're trying to, it's almost like your tub. You'll have grime or residue on there that needs to be cleaned off. Motion is lotion. So the movement of the joint helps to wash the joint. A simple analogy is frozen shoulder. Somebody injures the shoulder, they don't move their shoulder, it becomes frozen. Or if you ever had a broken bone and you had a cast on, when you get the cast off, the joints are all stiff. So I'm trying to get the joints moving. And some people that do, I've had massage therapists come in, and they're, if you're working deep enough, you're going to be getting some of that mechanical joint mobility restored, which is what I'm trying to do. And so I am trying to clean the muscles, but only insofar as to get some of the pain down. My main purpose of massaging is to get a better adjustment so that the spine is limber enough that they can actually start stretching, and then they don't need as much time or massaging. But it can be pretty painful. I think you'd be surprised. Some people, very quickly, once you get all the gua sha marks out of people's backs, a lot of that pain dissipates. What a lot of people are feeling is that bruising in the spinal column because nobody's ever cleaned their back. It's the amount of spinal care, healthcare in America is very poor. We do not have healthcare of the spine in America. We have illness care, which is reactive care. We wait till there's a problem and then we treat the problem. I mean, I had a patient today, cortisone shots, nerve ablations. We cover up the problem. We don't. It's like if you had a check engine light on your car. I don't think the best treatment is to. Not saying that, there are times and places for things, but a lot of times in America we're covering up problems.
Craig H, thank you.
Thank you so much.
Yeah, thanks for answering my question. Best of luck. Oh, thank you. How tall are you, Ed? Somebody asked that. Oh, can I? Yeah, I don't know how to say that.
In the morning,
How tall?
definitely 6'2". Probably by the end of the day, maybe 6'1.5".
You want to read it?
So Julian says your advice through the videos are so helpful. I learned that you used to be an OG in games. Which ones are your favorite to play? I started PC gaming was, my goodness, Duke Nukem, Quake, Half-Life, Counter-Strike, StarCraft, Command and Conquer, Red Alert. I mean, we're going back to the 90s here. I used to have dial-up modems and connect with my friends through dial-up. So that would be my beginning in PC gaming. And then obviously, Super Nintendo and Mario and all that sort of thing. But yeah, I try to limit it now a little bit, but you see, I'm in the DC area, and for the longest time, the DC, after your name was where you were located. After a few minutes of digging, I realized I played myself. Thanks, Clay. Yeah, DC is Doctor of Chiropractic, so, but let's see here. She left me. Untame Your Flame says, can chiro help fibromyalgia? I have a friend that has that. So fibro means connective tissue. Mya means muscle. Algia means pain. So I'd like to usually say that fibromyalgia, if you translate it, it means connective tissue muscle pain in so many words. And so the first thing I would, again, without saying anybody, I need to be more specific, but sometimes, so how to diagnose somebody with fibromyalgia is very broad. Pain on, I think it's 11 of 18 points. Where are these points? What kind of pain is elicited when you touch the point? How much pressure to elicit the pain? So it's pretty broad. I would, again, I think that it's more or less that the spine is inflamed. And because your spinal column is inflamed, all the nerves that exit your spinal column are irritated, therefore giving you pain throughout your body. And so I've treated a lot of people with fibromyalgia, and I've seen a lot of benefit by getting their spinal column not to be so sore and tender. So I hope that.
Brandon, Vincent, I love when you talk to yourself in third person. Anytime you say Ed during a video, I crack up. I love that part too. And I've caught him talking to himself many times.
Oh, that's probably one of the, if there's the embarrassing story.
That's the embarrassing story. There you go. You share that one.
All right. So early on in our marriage, she told me that she was leaving the house, and let me back up. So my computer, my whole setup was outside on this back patio because our house was pretty small. And so I had my computer on the back patio, and, I just take my shirt off and just play out there. And my wife likes it pretty cool. So it being warm on the back patio here in Florida. So she would come out and, hey, how's it going? Everything okay? I'm going back inside. It's pretty hot out here. So anyway, it was kind of like my little man cave on the patio. But anyway, I was playing games out there, and she tells me that she's leaving to go to the store. And so she is supposed to have left. I mean, she didn't leave. I'm sitting there playing games outside, and I don't remember what I was saying, but I must have been joking to myself.
He talked to himself, like laughing, almost belly roll laughing to himself for like a whole couple minutes. I sat there and just watched it. It was the funniest thing. Totally.
You have to practice your delivery. You can't just.
Yeah, it was funny. You were totally in the zone. Anyways.
So I must have been telling myself jokes, and then
I don't know what you.
Anyway, I look over and I see her staring at me through the glass window,
what are you doing?
And it kind of startled me. I was like, how long you been standing there? She's like, about 20 minutes. You were just sitting there talking to yourself. And I was like, I haven't been married long, and so she's like, what the heck have I gotten into? This guy's crazy.
I was looking at your shirtless self playing video games, talking to yourself. Anyways, that was funny. Okay.
So Carlin does record. She does the recording. Yeah, she's gotten really good at what she wants, the angles that she wants.
Oh, did I record him when he was talking?
Oh, did you record him? Oh,
I wish. Then. No, I don't have it on camera. But I do record him right now. Yeah. Perfect embarrassing.
Well, you got to practice your delivery. You can't just think this stuff comes out easy. You got to work on it.
Did you always? Oh, that's a good one. Jacqueline Carlin No, you spelled it right. Good job. Did you always have good posture, or did Ed teach you? No, Ed taught me. I did not grow up with chiropractic. I didn't really even know what a chiropractor was until I met him.
My dad's so bad. So the first time my wife comes in, I think we were dating, I think, this time. And so of course,
he adjusted me in the pew at church.
I know, but the first time my wife comes to my office or my dad's office, and he immediately takes an x-ray of her neck. Get over here. Takes an x-ray of her neck, kind of like I'm a car mechanic, putting a car on a lift and, examining the car. My dad pops his head out of the x-ray room with her x-ray and goes,
yeah, I was not gentle on my body. I didn't grow up with chiropractic. So I grew up riding horses. I've fallen off more than I can count. So he's taught me how to take care of myself. I don't know where I'd be without him.
Where's that question? Who's that question they asking?
Let's see.
Oh, Martis.
So
go up and see if we can figure out where that.
Please answer my questions. We haven't seen them. So
maybe go up.
How to go up?
Sorry, Hope, I missed your question. Let me see if we're trying to. Here we go.
Should I see?
So Hope Martis says, should I see a chiropractor? My regular doctor says have the beginning stages of degenerative disease. So I'm assuming they're meaning degenerative joint disease, that when you overstress a joint, the joint will grow, the cartilage gets thinner, nerve pressure, numbness, pain. So yes, you should see somebody that can help take the stress off those areas. Hopefully they're, trained in changing the posture, getting the curves back in your spine. Unfortunately, the word chiropractor has become as broad as the term restaurant. I think this is probably the best way to describe it. So if I said, go out to a restaurant, everybody, have a good dinner, people might say, what kind of restaurant are you talking about? I mean, Burger King, Chick-fil-A, or Stonewood, or Capitol Grill, so there's a lot of variance in the type of restaurant. So chiropractic has become a very broad term. Some chiropractors I would call more fast food. Some are more, you're going to be there a while. And so a much more complicated answer to that question would be, I don't believe in the terminology of degeneration. So to give you a small bit, if the bones are getting bigger, why do they say they're degenerating? I think a better word is regenerative. So I call it regenerative joint adaptation. It's going to be in my book soon. Instead of degenerative joint disease, I call it regenerative joint adaptation. So the bone growth isn't a disease process. I know they call it that, and I know you can't say regenerative joint adaptation, but it leads to this constant mindset that you have this disease in your neck that's just out to get you. It isn't. It's the body adapting to stress. We need to understand why it's happening if we want to stop it from growing.
Thank you, LVRNC.
So yes, go see a chiropractor.
Thank you.
LVRNC asks, thank you for answering the question as an
you,
NP student. I appreciate the fact that you always explain everything you do and all it makes sense. Cheers. I really appreciate that. Thank you. I tried my best. Congrats on getting 200,000. Let's get to 1 million.
24 cups and counting. We recognize you. You've commented. Yes. Congrats on getting 200,000 subscribers. Let's get you to 1 million. Oh, thank you.
Thank you.
Yeah, cool.
How sciatic pain can affect your pregnancy. This is R333 Saeed. Other than not being, I used to work on Carlin a lot.
Yeah.
We've had 4 pregnancies. And so,
make it miserable if you have that.
The baby's head, so the front part of the sacrum, there's a lot of nerves coming out of there. And so as the baby descends, starts to put pressure on the sacral nerves, that can cause sciatica. Getting worked on can help move some of the stress, balance the spine. But in the 3rd trimester, it's really just hang on. And I help women.
He's helped me a lot, just digging in there, keeping me accountable to my stretches, keeping everything, balanced. Just having a chiropractor is helpful.
And Maxwell's here. Say there's Chiro to the Max there. Hey, Max.
Brother's here. Hi, Max. You need to be somewhere with us this week. We'll talk to you later.
Oh, thank you, Hope Martis. Yep. God bless you.
What's this one? Oh, here we go.
24 cups and counting. I was here when they were 25K subs and have followed you ever since. Love Dr. Upload days.
Oh, thank you. Yeah, we recognize you from early on. Thank you for following for so long. Appreciate it.
What kind of scrapers do you use on the
Mommy.
patients? Oh, Mom's here. Hey, Mom.
Hi.
Look, Mom, I made it.
She's saying hi to Max, though, not
Oh,
you.
oh.
She sees you too much. Just kidding.
Mom, I'm the one streaming here. Hi, Max.
Oh, Max says sound good. That means, yeah, you'll have to be in a video.
What kind of scrapers do you use? I think the ones we have are from, they changed the website. It's Gua Sha Orthopedics. I think they changed their website, but if you Google Gua Sha Orthopedics, that's the one I use. It has been the most comfortable, but again, it doesn't have to be that one. They make thousands of different variations on the Gua Sha tools. A lot of them work really well. I've used a jar lid and a pinch, but
Pockets of Ocean. Pockets of Ocean
asks, how effective is the Denerol? So before the Denerol, we had other ways of changing posture that were very effective but very intense. They're called wall traction units. There's full body wall traction units. I haven't really showed that on the channel, but Chiropractic Biophysics has had those around since the 90s. I've grown up. My dad had a table. It literally looked like something out of medieval times where they actually would strap in each section and then you'd hold people in the mirror image. So there's more effective tools than the Denerols, but I don't know how many people would sign up for it. I remember telling my dad as a teenager, Dad, people aren't going to be able to handle this. And, they went to the wayside. But the Denerol is a good compromise. It allows you to give you results without overwhelming a lot of majority of patients. And so that's where, and then you can take it home and be trained on how to use it. And it gives you kind of like a toothbrush, a tool to use. So you don't have to have so much care and you can, go home and do it yourself. So, should we stretch every day or a few times a week?
Who's it?
Every day. It's the bottom there. This is from S Diamond. Okay. So I'm going to use the teeth. We brush every day. You need to stretch every day. Now, if you don't have 20 minutes, even just doing a few minutes is better than nothing. So just get on the stretch, especially before bed. So I think of it like brushing your teeth. You don't brush your teeth, eat a bowl of ice cream, and then go to bed. That would kind of negate the entire cleanliness that the toothbrushing did. So you can't just complain to your dental hygienist and say, I brush every day. Why isn't it working? Why am I getting all these problems? You have to end the day on a high note. You want to put the spine in the right position and then go to bed. So if you have any time to stretch, it would be half hour before you go to bed. You want to get the spine kind of prepped for sleep into a better position so that, a lot of times in the morning we hurt because of what we did the previous day, or we didn't get our spine clean before we went to bed kind of idea.
I don't know. I didn't see this one. Maybe they could ask it again. SMN, can I ask my question again?
Please, yeah. I'm sorry, we're missing people.
We are
questions here.
definitely
Go up,
missing
maybe see if we
questions.
find it.
I just looked.
Up there. Hi.
Oh, hi.
Hi. Is that Nook? Is that Nook here?
Where?
Nook McLaughlin. Nook's here. Hey, Nook.
Hi, Nook. I don't know. Maybe that's down here. Wait for it.
Is it possible to stretch too much? It isn't. Philip has it.
Oh, this is interesting.
I would say no, because if you're stretching properly, it's like saying, because of how much time we spend bent forward, I don't think it's possible to bend back too much. Now, I guess if you didn't bend forward at all and you're floating 0G like Tom Cruise or up on the space station, or I think of Tom Cruise in Mission Impossible, like floating, unless you're like that all day, then maybe you could go towards over bending back. But it's like, can you eat too much lettuce? Maybe, but you don't have I don't think so.
We look down too much. So.
Our life is inundated with bending forward. So I would say it's difficult I haven't seen it. If it's possible, I haven't seen people that now you can, if you're not bending evenly, you can pinch areas that are hypermobile, and that can not be good for you. So yes, you can improperly stretch too much. But if done properly, many patients I'm trying to, the patients that get the best results take what I say to do and go to a much higher level.
Hi, Connie.
Connie, wow.
We
OG
miss
patients are showing up
you.
here.
Hi. I miss you.
Connie Thompson has
Hi.
been in our lives probably before I started practicing. I think she started seeing my father. She's got some cool stories.
Tell Chris hi.
Connie, I'm gonna tell your story. So Connie went and saw. Sorry, Connie. Yeah, I miss you too. She had gua sha with my father, and she went into I think she was at a medical doctor office, and they saw her back, and they were just like, "Who did this to you?" Right, Connie? Right? Who did this to you? This shouldn't be done to an animal. They saw the bruises on the back. They didn't and she was like, it felt pretty good. And she was like, well, it was some sort of medicine. It was, and she kind of didn't want to out us, but like they were so upset. So we're located in Sarasota, Florida.
Oh, from Germany? Oh, interesting. I don't even know how to say it, but it says, good morning from Germany. Good morning. My name's Quinn. And how would you go about fixing scapular winging? Or what advice would you give for scapular winging? Keep up the awesome work. All thanks.
Right. So when you have scapular winging, it's the long thoracic nerve, serratus anterior muscle. There's the long thoracic nerve comes off the brachial plexus, which is coming from your lower neck. So it ultimately is about taking stress off the lower neck. If the nerve that goes to your serratus anterior is not working properly, and if it's been numb for a long period of time, it might not be possible to undo it. Depends on how long there's been damage to that nerve. Generally, what I've seen in my office, if it's been there for more than a year, it's very difficult to undo it. If it's been there for a little while, it's much easier. Nerves are different than other types of tissue in your body. Once they've been cut off for a while, it's hard to bring them back. So I would take the stress off the lower neck, try to get the shoulders back. So you want to not, round forward. That, puts more stress on your lower neck, which then aggravates the long thoracic nerve, which then causes weakening of the serratus anterior muscle, then further progressing the winging. Hope that helps. What is a common, Sam Sarna asks, what is a common misconception that you think should be cleared up when it comes to posture or spinal health? Common misconception. What do you think?
Where is it? I wasn't paying attention.
What is a common misconception you think should be cleared up when it comes to posture? First, many chiropractors believe that adjustments change posture. So that's a common, I would say it was only taught that way from 1895 when chiropractic started to 1997. That was the only information out, was that adjustments change posture. Enough research was shown. There are two techniques that deal with posture. One's chiropractic biophysics, one's Pedibond. Pedibond has a more muscular approach. So one of the things they'll do is they'll have a little strap that you put on your head, and they'll put a weight on the front part of the head. And by wearing that strap, your body recenters the weight, and then you retract the head over the shoulders. It's okay. I might start incorporating more of that. One thing I don't like about the head weights is that you are putting more weight on the disc. You're making the head way heavier. Even though you're changing the posture, you are putting more stress on the neck. But there's Pedibond and chiropractic biophysics that change posture. So spinal health, I feel like there's just no, people don't think it's important. Yeah, there's very little, we don't know what to do. There's no advice given to it. We literally we live in, at least my understanding is that we live in a reaction care world where we just react to a problem. There is no health care with the spine. So it's just a lack of care.
Some people say, I've heard people say that alignment doesn't matter. Like I don't know how popular, but I've heard.
Tell that to your car mechanic and your orthodontist.
Yeah, that's a misconception.
You can, whether you believe in an alignment or not of your car tires, it's still going to matter. Your tire needs to be balanced and, aligned properly. Otherwise the tire wear out unevenly. So in the same way, your posture needs to be aligned so that your spine ages evenly. Whether you believe it or not, it's like, sorry.
Dragon348. Thank you for doing what you do and how you explain it. I always learn something.
Thank you so much. So this is Natalie Urzi says, when I was 18, I was diagnosed with arthritis in my neck and severe loss of cervical curve. I was seeing a chiropractor for a while, but they couldn't afford any more. Anything I can do on my own. So the first simple thing is just be always aware of the chin to your chest. So every time your chin comes down, or you're generally the phone or schoolwork or reading, or, every time you tuck your chin down, you're losing that curve, which is causing certain parts of your neck to be overstressed. That's when it degenerates, which it's really regenerating. But the bones grow, you get pinched nerves, pressure on the nerves, inflammation. So arth means joint, itis means inflammation. So the word arthritis means joint inflammation. I like to use English words just because we get so, it's like, I feel like arthritis has like this, like, I don't know, scariness to it that people come in like arthritis, and so if just joint, can chiropractic help arthritis? Well, yes, chiropractic can help with your joint inflammation. Your joints are inflamed because your posture is not correct. Parts of your spine are doing triple the work. So therefore they're, inflamed because they're doing more than they're spec rating. They're doing more than they're supposed to. So what can you do on your own? Try to not tuck your chin down so much. Try to be aware of your posture. Sit backwards on chairs. Like I have a couple of things where just being aware of where your shoulders are. Try to be as upright as you can. Reduce your sitting. Sitting is the new smoking. It just is. It's, I go to the mall. We go to, theme parks. People are walking around looking down at their phones and they're waiting in line, looking down. People, how many times have you seen somebody just their neck is tucked to their chest for long periods of time, and there's zero awareness that this is causing a problem. So that getting to the cause of why it happens. I did not always want to be a chiropractor. So ionized coyote.
Did you always want to become a chiropractor?
Did I always want to become a chiropractor? I took an aptitude test when I was a teenager, and they said that I had two aptitudes. So aptitudes, I guess, are different than skills or talents. It's like something that you are good at and you'll like to do is what I was explained was the definition of an aptitude. And they said I had every aptitude for being a good student. I was like, okay, well, am I a career student? But they said the other aptitude I had was spatial analysis. They said I could rotate objects in my mind easily. And I, embarrassingly, if I'm in a bathroom, I see like, shapes or tiles in and I just sit there and rotate them in my mind. And I've always done that since I was a kid. I've never been able to stop it. It's just, so they said I'd be a good dentist, orthodontist or something like that, because you could visualize the bones and move them around. And so I did think briefly about being an orthodontist, but
you saw what your dad was doing.
Yeah, I just want to be chiropractors much more. Don't have to be in people's mouths. Brenda does the glove work and the pterygoid.
You need to do that. He doesn't want to, but he can.
I like working on the masseter temporalis, but yes, you can go internal. It's fine. I'll get my gloves on.
You should. It's funny. You're welcome. This has been Brad. Brad, what are the effects of boxing on the spine? Love your work. Good question.
So, with boxing, it's just when you have any type of physical force put on the spine, most of the movement's going to happen where it's already moving. So if you have a punch to the spine, if part of your spine is already injured, then it's going to get further hypermobilized. The joint will be inflamed, arthritis, the bone will grow. So generally you'll see a lot of the bones a lot larger in certain areas in boxer spines. You want to have the whole spine working evenly as best you can. My main thing with anything that puts stress on the spine, my main thing I tell my patients is get paid for it. If you're going to box, get paid for it. If you're going to play professional football, at least they're getting paid for it, but it's, might be an extreme. It's going to be an extreme position because I grew up a chiro kid. My father saw a slide tackle when I was 10 years old, and a kid broke his ankle in soccer, and my dad was like, "You're done." So I definitely wasn't.
Do you get
I learned how to rollerblade with a pillow strapped to my butt,
For real. He's not joking.
So, my spinal health was highly valued. Boxing wouldn't have.
Do you get whiplash when you get hit? Or like,
So the joints are going to get injured, and then they're either going to grow or your posture is going to change to try to take stress off joints.
sure we missed a lot. All right, maybe we'll just answer one or two more, and then
All right, just a couple more questions here, and then probably we were thinking about an hour, but you guys have really just hung in there.
Yeah, wow, weird.
Thank you for being here, everybody. Hey, Quint.
Oh
What's
yeah, here's the question, Mr. Roboto. Have you ever needed to walk on a person? Ooh, I lost it.
There are
to get that crack. Haha.
There are some black belt, I call them black belt patients in my office that I routinely walk on. I won't name them because they get, but yeah, I have some really, and they'll actually ask for it. Once your spine, is cleaned and you want that real deep, cleaning. So some people I do walk on routinely.
S Diamond, what do you think of red light therapy?
So that's a tough one. I think my most basic answer to that question would be I don't. It can very well work. I just don't understand it the way I really think I should be able to explain it. There are a lot of different red lights there. So I think we're talking about like K laser or the Giga laser or the Beamer pads, or there's a lot of different lasers. The difficulty with it is that there's a lot of different wavelengths. There's a lot of different frequencies. They range in price a lot. I go to the seminars. I do talk to the vendors. I try to understand what's going on. They use words sometimes that I try to see. I can't use anything on a patient that I can't understand. And if I can't understand how it works, I'm not saying it doesn't work. I just don't understand how it works. I've had people do red light therapy and love it. So I am open to it. I'm open to trying new things. When I talk to the vendors, I don't get answers that help me understand how it works. They use words like microcirculation, and I have a trouble understanding what they mean by that. So it very well could work, but I haven't tried more.
James Kelderman. Hi, James.
Oh my gosh.
Yo, Dr. Ed, you are the man. Hi.
Thank you, James.
Connie says she loves to be walked on. She does.
She's tough. Connie is one tough.
Ricky S4, love your work.
Yeah, she is.
That's funny. I didn't. Oh, Molly. Hey, Molly. Molly Aldrich is on here. Hi.
Hey, how you doing?
I'm trying to answer the last few. Chilux, does gravity affect your joints?
Right. So the answer to that question is pretty easy. So the astronauts that are up there in 0G, the space station, they actually have to be compressed for a number of hours. I think they put them on treadmills, and then they have bungee straps attached to like a harness that compresses their spine. So, here on Earth, obviously we're compressed too much. And so we have to traction or extension traction to open up the spine. Up there in the 0G, they have zero traction.
Someone's asking. Sorry, just it's okay.
What is it?
You can keep going, then we can.
So yes, gravity. We definitely need to be under gravity. So the disc, it's like Goldilocks, too hot, too cold. If there's no gravity on the spine, they actually swell up so much that they rupture from no gravity. So that's bad. And then here on Earth, generally, you have too much gravity, too much stress, causing disc herniations over time. So,
yeah. Do you want to look at that one? I think that's what. I don't know.
How would you go about treating someone? So myalgia parasitica is lateral femoral cutaneous nerve pressure. So this is more.
Laquan Lee, how would you go about treating someone with, I don't know how to say that.
Yeah. Yeah, so this is about nerve pressure. So when you have nerve pressure, we need to get the curves back in your spine. The inguinal area, there's pressure on the nerves, generally from sitting too much. That area is being folded. That's where the nerve is being crimped. So getting the arch back in the spine, uncompressing the front part of the body, opening up the inguinal area, and reducing pressure on the nerves in your lower back.
Good night, Dragon 348. Thanks for joining. Someone asked, Nick, are you and Dr. Mondragon siblings? Are you?
Yeah.
Just kidding.
Yes.
Yes, he's Brenda's brother.
Where did Devin say? We got one more there. Devin shoulder take it. We go up. See what we
Where,
find.
Devin?
Finding your question. Devin.
We're finding the last.
Go up here.
Where is it? Is it? Oh, wait, hang on. Can you ask it again?
You gotta get Devin's question. I can't let him.
Devin. Can't find it. Could you ask again?
Oh, is it there? Devin, hi.
I can't find it. Oh,
Sorry, Devin.
dang it. Where'd it go?
Can you harm your neck self-adjusting when you monitor? So yes, you can definitely overstress parts of your neck
Is that it?
that are hypermobile. So if you have a part of your spine that's been overstressed, if you pop your own spine, you're mainly going to continue popping the parts that are loose, which further aggravates them. So we want to not continue adjusting parts that are hypermobile. So if you overwork a muscle, mine didn't do too good, but some guys, right, work their muscles out, they grow from stress. In the same way, when you overwork a joint, it causes it to grow, causes nerve
They
pressure.
said we need glasses. I think I agree. Or it might be the light in our eyes.
Yes, I'm
It's
sorry.
making this
Oh,
hard.
we
Okay.
definitely need some. This is our first time. This is our first time streaming.
We have a
everybody.
light shining this way and it's making it
Got
difficult.
this ring light over here.
I'm probably should turn off.
Blinded by the
Yeah.
light.
I can't find Devin's question. Was that it? No, I don't think that was it. Oh, sorry. Oh, here, right here. Well, this is not it, but Abel, thank you.
Thank you, Abel. I'm in Chicago, and how would
How
I
would
be
we be
able to
able to-
find your treatment by me? So again, just trying to call different chiropractors. Again, it's the word chiropractors is diverse as the word restaurant. A lot of different variations. Try to see if they do hands-on work. You can ask that. Just call up the office, talk to the secretary, say, "Hey guys, do you do the massage or do any deep tissue work?" Then call the next chiropractor. Go down the list from the closest chiropractor to you to the farthest. Say, what therapies do you have at your office? If they do a lot of electrical or lasers, it doesn't mean you don't go to them, but you could ask the next question, which is, can I observe an adjustment? Can I come in and see what you guys do? That shouldn't be a question that just, no, you can't come in and watch what we do. It's a red flag to me that you're so secretive with what you do that people have to pay money in order to see what you do. So that might be rare, and I'm sorry if it is. But ask chiropractors like, hey, can I come in and see what you do, and ask questions before I get treatment, before I sign up, before I fill out paperwork? Can I have an idea of what you're doing? And if they're so busy that they, aren't going to do that, then
Wait,
call the next closest chiropractor.
Devin Shoulders, that's the question. Was your question? Can you answer my question?
So the other way would be to go on Chiropractic Biophysics website, idealspine.com. There's a doctor finder on there. And so that'll at least get you into the right category. Guys that are interested, like I said earlier, nerdier, believe it or not, than me. Guys that all they care about is getting the curve back in your neck, curve in your lower back, getting your ear over your shoulders. We call it the plumb line. There's a line from here, shoulders, hips, knees, ankle, malleoli. You got to get that lined up properly from the side. So Chiropractic Biophysics or idealspine.com. Go on that website. There is a doctor finder. You have to continually go to their seminars to stay on the list. So there could be guys that do chiropractic biophysics, myself, that aren't on their list. So it doesn't mean, even if there's nobody nearby you, you can still call the closest chiropractors to you and ask them, do you guys do postural work, or is it just kind of, clicking bones and, real quick care? But hope that helps.
Angel saying good night. Good
Well,
night.
thank you so much. I appreciate everybody.
Yeah.
Thank you for all your questions. Maybe
Lamar, I love watching your videos.
I'm sure we'll do this again.
Yeah. So,
Thank you so much for everybody coming. And did you want to?
yeah, I think we'll probably get ready to call it a night.
I
Thanks
am
for
watching
coming.
Better Call Saul season 6. I like that. Lalo. Yes, it's been good.
Oh, really? That's funny. They're
I don't know
watching
how
it
they
too.
knew that I was watching it, but yes.
Oh, these are nice
Yeah,
comments. About
I am
5
watching.
times.
It's been fun.
What was this one? We missed that one. SMN. Oh, the shoes. Were you? I think SMN was asking if shoes affect. We missed that one. I saw it briefly and
Go
forgot.
back. Can't leave without,
I
have
know.
this
Sorry.
Sorry.
I think did you ask about shoes and how they affect?
Is
Here.
surgery the only way to fix a herniated disc?
Okay. Maybe someone else is about shoes.
So surgery, many times even the surgery isn't fixing. I mean, it depends on your definition of fixing, but I would say that the best way to help a herniated disc is to stop stressing out that area. So, but the long answer, the short answer. So a herniated disc involves a long-term period of injury and stress on a disc, which takes the disc from being self-cohesive to one where the nucleus has cooked its way through the layers that wrap it, causing the disc to herniate. So the best way to sort of view that is to try to take pressure off the disc, get the curves back in the spine, balance the spine, bend in other areas that aren't injured. So what we find is that there are 24 vertebrae, 22 discs, 5 discs have all surgery. So if you see somebody with a disc injury, you can pretty much say L4, L5, lumbar 4 and 5, and cervical 5, 6, and 7 have 99% of surgery. This is from the surgeons, not from chiropractors. They're operating exclusively on the lower neck and lower back, and no one talks about it. So why are all disc herniations cervical 5, 6, and 7? Just statistically, I've seen a C4. Somebody say, I've seen a C3. There are out there, but high level of frequency of 5 discs having a majority of injury. Why is that? They say it's age and weight. I go, well, how old are the discs around the ones that are injured? They're all the same age. How much weight's the upper back carrying? More than the lower neck. So age and weight are not the reasons why disc herniations occur. It's alignment and mobility. The spine isn't lined up properly, and the areas where the discs are herniated are hypermobile. So you're grinding the cartilage. The cartilage is like tread on a tire or like the enamel on your teeth. So the alignment is putting stress on certain areas, causing them to age too quickly. So is surgery the only way to fix herniated disc? I would say that they go in there and they clean it out. So they call it a discectomy. Any part of the disc that's herniated, they clean off. Then you end up with getting more stenosis. They end up usually having to do a rod at some point. So the discectomy rhizotomy surgery is usually not end game. It's usually your back. I have many patients that have those type of surgeries, and they end up getting more and more surgery. So none of that treatment ends up getting to the cause of why those discs herniated in the first place. And the best way to view that is the care that I provide takes the stress off that area and puts it somewhere else. I hope that helps. All right. Is anybody else mad that I didn't answer the question? I'm sorry. I'm doing my best.
We'll do more live streams now that he finally got on
All
here
right,
to do one.
I think we're going to wrap it up. I think we got most of everybody's questions.
What's your favorite food before they leave? People ask random.
My wife's chicken pot pie. She makes a really good taco. What is it? Taco? Was it lasagna made?
My mom made.
It's
But
really
I
good.
make it
It's
too.
really good. It's a really good taco.
You love chicken.
Chicken pot pie. Spaghetti Eddie was my nickname growing up a lot.
Yeah.
Probably should have said that, but I had a lot of spaghetti. Love pasta, but it's highly inflammatory. You gotta take it easy.
All right.
Okay, SMN. Thank you. I hope I got it. Spaghetti Eddie. Yeah. Oh, there he is. Jamie, of course. Jeez. Hey, I got a photo of you at 14 on my phone still, but
We should show it to everybody.
I can pull it right up. In a second, but careful what you say.
All right.
All right. Thank you so much for everybody coming. I appreciate all the support. Thank you so much. I'm sure we'll do this again. Really, just thank you so much, everybody.
And thank you for those who donated too. That's amazing.
Thank you so much for donating. I'm sure we
Wow.
are seeing Brenda and Dr. Brenda and Dr. Max soon. We'll probably have a video coming up soon with them. And
follow him on Instagram
please,
too.
follow Instagram.
And
We're on the Instagram
subscribe if
thread.
you haven't subscribed.
Like,
we appreciate
leave a
it. Yeah. And maybe next time we can ask what people want to see more. You do.
Leave questions.
Think
We're
about
like I
that.
said,
Yeah.
we're
leave
if you have
questions
any-
in the comment sections or suggestions. So, all right.
Thank you, everybody.
Good night.
Good night, everybody.
Good
See you later.
night. I don't know how to X out. Okay. Bye.